Bismillahirrahmanirrahim. We are going to start our new topic, which is actually septic shock. Septic shock is, I'm discussing septic shock separately because it is the most important mechanism, or it happens due to bacterial infection in our body. So, septic shock is very important with respect to UHS point of view. Many MCQs or many MCQs or SCQs for others are also present in this, and in clinical side you will observe many patient with septic shock. Even in nowadays, even with the development of health and with the development of many treatment options, still septic shock is a major cause of death, even in those countries which have very organized or well maintained healthcare system. Septic shock is every year can cause many deaths in any country. So and that's why septic shock is much important. We will cover some basic terminologies regarding infection in our body, and then we will discuss septic shock in detail. We will also see the pathogenesis of shock, how shock occurs in our body, and then we will discuss the signs and symptoms of the septic shock. We will also discuss the role of cytokines, and we will also discuss the some introduction about bacteria. To understand the infection in body, or to understand the septicemia or septic shock, first of all you have to you have to understand two to three basic terminologies. What is bacteremia? Bacteremia occurs in normally. Bacteremia is actually a presence of bacteria in our blood, but we have not faced any disease just due to presence of our immune system. In simple wording, when our skin gets ruptured, few bacteria gets enter in our body, but we wouldn't face any type of disease or any sign and symptom regarding bacteria. So bacteremia is actually a presence of bacteria in blood, but no sign and symptom, with no sign and symptom, with no disease cause. So in normal circumstances, few bacteria can enter in our even few bacteria are entering from our GIT tract into our blood, but due to our immune system, due to our strong immunity, we are not facing any disease, or we are not facing any type of sign and symptom. This is actually blood usually a sterile fluid in our body, but if bacteria is present in blood, but no disease is caused by the bacteria, this is condition is known as bacteremia. And what is septicemia? Septicemia is a dangerous condition because in septicemia, blood bacteria are present in our blood, and they are also multiplying in our blood, in our body. So if they are multiplying in blood and then they are causing a symptom or disease, this condition is actually septicemia. So septicemia is a condition in which we can face disease, or we can face sign and symptoms. We can face severe disease, severe sign and symptom, or even if septicemia is not get treated, then it can lead to death of the patient. So septicemia is actually a diseased condition or presence of bacteria in blood with disease, or with the presence of sign and symptoms. Then another condition is endotoxemia. Endotoxemia is actually a presence of toxins in our blood. What is mean by toxins? Many bacteria released uh, toxins. For example, most of them gram-negative bacteria released some lipopolysaccharide structured toxins. These toxins are not bacteria. These toxins are actually lipopolysaccharide structure but released from the bacteria. So these toxins, if toxins are present in blood, this is known as endotoxemia. It is known as toxemia. And what is endotoxemia? Usually gram negative bacteria released endotoxin. There are two types of toxin, endotoxin and exotoxin. Gram negative bacteria usually release endotoxin. So endotoxin, so presence of endotoxin in our blood is known as endotoxemia. And common cause of shock in our body is actually due to and is actually endotoxin. So endotoxins released from gram negative bacteria. Infection with gram negative bacteria can lead toward the shock, and it can be fatal if remain untreated for a long time. So, if we classify the bacteria on the basis of gram staining, there is a classification, a gram staining. You have already studied in FSC that the gram staining technique. So, if we classify bacteria on the basis of gram staining, there is a huge difference between cell wall composition. In gram positive bacteria, cell wall is usually thick. You can observe in left diagram in which peptidoglycan layer is thick. Peptidoglycan layer is more thicker than the gram negative bacteria. So due to thick layer of peptidoglycan in gram positive bacteria, they have thick cell wall. And gram positive bacteria no endotoxins or no lipopolysaccharide structure is attached with the peptidoglycan layer. So blue and light blue color molecules in the left side diagram showing the peptidoglycan structure. So though no only teichoic acid or other surface protein are present, but lipopolysaccharides molecules are not present in the gram positive bacteria. So only peptidoglycan layer is present. So in gram positive bacteria, cell wall is usually thick, and lipopolysaccharides are absent, and you can see no lipopolysaccharides are present in gram positive bacteria. So we can say no endotoxins are present in gram positive bacteria. But on the other hand, in gram negative bacteria, as you can see in your diagram uh, uh, right side diagram, that there is a thin layer of peptidoglycan is present. A thin layer of peptidoglycan is present, and on the peptidoglycan is not a outermost boundary. On the upper side of peptidoglycan, lipoproteins are present. Here we can also say that their lipid A molecules are present. Lipid A molecules are attached with the outer membrane, which is actually lipopolysaccharide. So in gram negative bacteria, less peptidoglycan is present, but more lipopolysaccharides is present. This lipopolysaccharide structure, this whole lipopolysaccharide structure, which is attached with the lipid A molecule from behind, are act as endotoxins. So endotoxins are composed of with the lipopolysaccharides, and the exotoxins are actually protein in nature. But most of the septic shock is caused by the endotoxins, and endotoxin released from gram negative bacteria. So major cause of septic shock in human body is gram negative bacteria. There are few exceptions are there, like gram positive bacteria release not endotoxin like structure, endotoxin like proteinous structure, which is actually known as exotoxin. So exotoxins in few gram positive bacteria, exotoxin can also cause shock in body, but but gram negative bacteria are major cause of shock. Gram negative bacteria in gram-negative bacteria, outer membrane is lipopolysaccharide, and lipopolysaccharide can cause shock in our body. And you can observe that here that the lipopolysaccharide is attached with the layer of peptidoglycan or lipoprotein. So in endotoxin, here another point is lipopolysaccharides are attached with the bacteria, attached with the outer membrane of bacteria. Endotoxins are attached with the outer membrane of the gram negative bacteria. So whenever gram negative bacteria face death, then these endotoxins released from the surface of dead gram negative bacteria. So death of gram negative bacteria cause release of toxins. So if bacteria is present in blood, and after a lifespan, when bacteria or with the treatment, if a bacteria face death, then lipopolysaccharide structure or endotoxin released from bacteria. This endotoxin structure causes shock in our body. How lipopolysaccharide activates our our cytokines to cause shock? Let's discuss in our next slides. How we can say that septic shock is caused by the gram negative bacteria, or what are the different steps are involved in the causing of shock. First of all, lipopolysaccharides are present on the surface. You have to understand that lipopolysaccharides are present on the surface of gram negative bacteria. So when gram negative bacteria face death or get death, then lipopolysaccharide release from the outer membrane. When lipopolysaccharide release from the outer membrane, these lipopolysaccharides binds with the proteins, special proteins in our body. So human protein binds with the endotoxin. So these human proteins with lipopolysaccharides binds with the CD14 receptors on different cells, like CD14 receptors on different cells, like endothelium, macrophages, monocytes, and toll-like, and with the toll-like receptors. When these proteins and the lipoproteins attach with the CD14 and a toll-like receptor, due to activation of these toll-like receptors, their signals gets activated inside the cell. So when changes occurs in the cells, inside the cells, then cytokines, there are different kinds of cytokines released. So toll-like receptors attach with you. You will if you see a diagram in your Robin's pathology, then you will see a PAMPS. PMPS is attaching with the toll-like is attaching with the receptors on the outside. What are the PMs? PMs are actually pathogens associated molecular patterns. So actually these are endotoxins, which are PAMs are actually pathogen associated molecular patterns. These are actually patterns. These are, in other words, in simple words, is endotoxins, which are attaching with the toll-like receptors. So when these PAMs attach with the toll-like receptor, on the other hand, when endotoxins attach with the toll-like receptors gets activated, they release signals inside the cells, and changes occurs inside the cells. When changes occurs inside the cells, in shorter wording, many cytokines release. So if cytokines release, you will soon we are going to start inflammation, second chapter, which is actually inflammation. So you will understand the role of cytokines. Cytokines are actually inflammatory mediators. So due to release of cytokines, inflammation gets started. Inflammatory mediator release Due to release of inflammatory mediators, inflammation gets starts. And when inflammation gets started, our body face many changes. If cytokines production is in a limited quantity. It means if cytokines are present but it's not raised, but the concentration of cytokines is not too much high. So then what happens is these cytokines are helpful in recovery process, but these cytokines can lead to a shock condition. And due to these cytokines, on the other hand, activation of endothelium cells occur. When the endothelial cells activated, then nitric oxide release of nitric oxide gets increased. When oxide release in a high concentration, then it causes vasodilation. So, well, due to vasodilation, due to increased nitric oxide release, it causes vasodilation, and the vasodilation is actually a process which can cause distributive shock. If the vessel gets dilated, then you can say the blood movement may get slow. If a blood movement may get slow, then it can lead to pooling of blood. So vasodilation or severe vasodilation can cause distributive shock. Here you can there is a summary of the septic shock, how lipopolysaccharides can cause shock in our body. So let's discuss about the effect of cytokines in our body. Common cytokines usually released in our body are the tumor necrosis factor, interleukin 1, interleukin 6, or interleukin 8, nitric oxide, and platelet activating factors. If a concentration of cytokines is low, means if cytokines are present, then it can activate monocytes and neutrophils. These monocytes and neutrophils can kill bacteria in our body, which are causing release of endotoxins and monocytes, and then activation of more monocytes and neutrophils can cause killing of bacteria. So killing of bacteria is beneficial for our body. And then endothelium activation occur, and the activation and endothelium activation is also helpful in the maintenance of many things. Then there is another important thing is activation of complement system. Complement system activation means there are usually C5A and C3A gets activated. These C5A and C3A molecules, when activated by the cytokine, these molecules act as a can help in the removal of bacteria in our body. So complement system is also very important in the maintenance of our body structure. So in short word, low cytokines can cause low cytokine are beneficial or good for body, or good for the maintenance of body or removal of the bacteria. If this condition remain untreated, means if a bacteria are still multiplying and endotoxins are releasing from the bacteria, then this condition can lead towards the moderate production of cytokines. So if cytokine gets production high, then these cytokines can move toward the liver, and can act on liver, and liver will release some acute phase proteins like CRP protein, and it can also cause increase in ESR. CRP protein is actually a C reactive protein, which is actually a acute phase protein, and by the testing of CRP, we can say that the patient is suffering from any acute condition, any acute disease. ESR is generalized test, which is normally used to detect some acute and chronic diseases. So increase in ESR is also indication that the patient is suffering from with some acute diseases. With the moderate production of cytokines, CRP production and ESR gets increased. On the other hand, if these moderate cytokines production moves toward the hypothalamus and acts on the hypothalamus, this condition can cause release of PGE2. So PGE2, prostaglandin E2, can cause fever development. So if hypothalamus gets involved, it can cause development of fever. So, moderate cytokines are also helpful in for our body by initializing the some acute phase proteins or fever. So it is helpful in the or uh, in sign and symptom development. If cytokine production gets very high, then what happens? Then there is a many destructive things happen, like endothelium of many cells and organ gets damaged. Then when endothelium gets damaged of many organ cells, then on the other hand, increase of nitric oxide occurs, and due to increase of nitric acid oxide and increase of platelet acting factor, you have already studied that the vasodilation occurs. So severe vasodilation gets activated, and with the increase of PAF and endothelium damage and cells activation, body can move toward the DIC, disseminated intravascular coagulation, means to say कि whole body moves toward the coagulation. जो है क्लॉट फॉर्मेशन बॉडी के अंदर जो है वो स्टार्ट हो जाती है. सो हाई कंसंट्रेशन ऑफ साइटोकाइन, तो ऐसे में बॉडी क्या है, शॉक कंडीशन में जा सकती है. सो मॉडरेट साइटोकाइन, हाई कंसंट्रेशन ऑफ साइटोकाइन कैन लीड्स टू द शॉक कंडीशन, एंड इफ it remain untreated or if remain untreatable for a long time, then it can lead to what the DIC, disseminated intravascular coagulation. And on the other hand, severe ischemia is also occurring just due to the low oxygen or low oxygen concentration, and on the other hand, the low blood rate or low blood movement, then due to pressurized pulmonary circulation. Then then severe ischemia is occurring. This severe ischemia and above mentioned causes can lead toward the multi organ failure. So as you have already studied in irreversible stage of shock, organ gets failed. So in severe ischemic condition, many organs can lead toward the failure. So can lead toward the necrosis or permanent damage. So ultimately, a body can face a severe or death conditions. Another important concept is actually super antigens. Super antigens are what type of antigens, or first of all, you have to understand about two things: antigens and antibodies. Antigens are actually external structure or external proteins which can cause production of antibodies in our body. Like if antigen from external environments get entered in our body, then our body recognize the antigens and form specialized protein like antibodies against these specific antigens. So concentration of antigen decides the concentration of antibodies. If concentration of antigen is high, then our body will release and form high concentration of antibodies. And if antibodies are high, then these antibodies will uh, help in the removal of antigen. So, what are the super antigens? These are actually antigens these are antigen like other antigens, but actually these antigens can cause sudden excessive release of sudden excessive activation of our immune system. It means our body, if like I have told you that के एंटीजेंस जो हैं वो उनकी कंसंट्रेशन अगर जितनी होगी उस लिहाज से एंटीबॉडीज़ बनेगी. लेकिन यहाँ पर क्या होता है, ये ऐसी एंटीजेंस होती हैं जो स्ट्रक्चर ही ऐसा है कि हमारी बॉडी में ये एंटीजेंस की कंसंट्रेशन कम होती है, लेकिन हमारी बॉडी में इम्यून सिस्टम उसके अगेंस्ट एकदम इतना डेवलप हो जाता है, इतना ज़्यादा डेवलप हो जाता है कि उन एंटीजेंस को हम कहते हैं फिर सुपर एंटीजेंस. सो सुपर एंटीजेंस आर दोज एंटीजेंस विच कैन कॉज सडन sudden and huge activation of our immune system against एंटीजेंस, मतलब ये ऐसी एंटीजेंस है जिनके अगेंस्ट हमारी बॉडी में ना जो है हमारा इम्यून सिस्टम बहुत ज़्यादा डेवलप हो जाता है सडनली, जिसकी वजह से क्या होता है आवर बॉडी गेट्स डैमेज, our body can face damage just due to the over activation or super activation of our immune system. So these activation are involved in the activation of many lymphocytes and macrophages. uh, this condition can observe in the toxic shock syndrome. So this super antigen activation or super or this the huge activation of our immune system, lymphocytes or macrophages, can lead toward this shock. So toxic shock syndrome is actually a condition which of condition of shock, but toxic shock syndrome is due to the gram positive bacteria, the common is staph aureus. So gram so from this slide you can conclude that a gram positive bacteria are also involved in the shock causing, but as compared to gram negative bacteria, there are very less chances of the shock production by the gram positive bacteria. Here I am going to summarize the pathogenesis and the different steps which are involved in the which we can face due to septic shock. Like first of all, inflammatory responses due to release of many cytokines, nitric oxide, tumor necrosis factor, interleukin 1, interleukin 6, interleukin 8, and platelet activating factor. And especially with the production of the nitric oxide, our body can face inflammatory severe inflammation or severe inflammatory response. So inflammatory responses are beneficial for our body, but with the limited cytokines, but with the limited or controlled cytokines. If cytokine gets released or inflammation gets high, then it can lead toward the destruction for our body. So inflammatory response can cause destruction for our body. And the next condition in endothelial activation, I have explained earlier that the endothelium also gets activated. So when endothelium activated, then you can also study. You have already studied that the endothelium activation leads toward the coagulation, leads toward the clot formation. So endothelium activation with the help of many other with the help of many other coagulation cascade, many other coagulation factors, and by the involvement of coagulation cascade and the platelet can lead toward the can lead toward the induction of procoagulant state, or induction of formation or induction of clot formation in our body, in our whole blood circulation. Like in DIC, disseminated intravascular coagulation uh, is actually a condition in which we can observe a clot in our whole blood vessels, and bleeding is also occurs. So and another condition is metabolic abnormality. I have not discussed about the metabolic abnormality. What are the metabolic disturbance or metabolic abnormalities? So metabolism is also gets active or damaged. Interleukin 6 in tumor necrosis factor, and interleukin 1 when acts on the liver faced resistance against the insulin action. So when insulin production and the insulin action gets disturbed, then glucose concentration in blood raised. When glucose concentration in blood raised, then our body is in the condition which is known as hyperglycemia. So when body face the condition due to lack of functioning of insulin receptors or insulin production, then so when our body face hyperglycemic condition, our body our body our neutrophils are unable to then our neutrophils are unable to perform their normal function, because in hyperglycemic condition immunity gets low just due to increased glucose concentration. So with the increased glucose concentration, body faced when body faced hyperglycemic condition, then our immune cells like neutrophil cells are unable to perform normal function. So when neutrophils are unable to perform normal function, removal of bacteria from the or bacterial pathogens from the blood gets disturbed. So if removal of a bacteria is not happening, then it can lead toward the more it can lead toward the more severe infection, or it can lead toward the dangerous condition, which is actually a septic shock. And organ dysfunction, we have already studied that there are many conditions, and there are many conditions here. There is a diagram also present in the Robbins like, which is showing the many changes in the cell. So when all changes occurs in the cell and the ischemia is also present, then these conditions lead toward the multi-organ failure or organ dysfunction, and these conditions can lead toward the organ death and necrosis and permanent cell damage. So here you can understand the some important changes in the in shock condition. So there are signs and symptoms which are actually differ from the hypovolemic shock. In hypovolemic shock, usually fever is not fever doesn't happen, and palms are usually remain cold. But in septic shock, as fever is occurring, then palm gets warm. So warm, it is also known as warm shock. Septic shock is also known as warm shock. In septic shock, heart rate usually increase, and the increased respiratory rate also occurs, and decreased blood pressure occurs just due to vasodilation, or due to pooling of blood in the peripheral blood vessels. And fever also occurs. There are 80% cases of there fever can be seen in the 80% cases of septic shock. But in septic shock, there are few cases when usually of septic shock, when you can observe only slight increase in temperature, which is known as hypothermia, or sometimes, or in 5% cases, fever patient, in septic shock patient, fever doesn't have occurs. So fever is also indication of septic shock. Shaking, chill, nausea, lack of urine. So these are all conditions which are related to the septic shock. Many signs and symptoms are different from the hypovolemic shock. In hypovolemic shock, there is a decrease in volume. So due to decrease in volume, palm gets cold. Periphery of our body gets cold just due to the low blood supply. But in septic shock, as fever is present, then our body is our body face a fever. So how you will manage septic shock patient? First of all, in laboratory, we can how you can observe, or how you can diagnose septic shock. There is a simple and a very important mechanism, which is actually blood culturing. So two to three different blood culture samples from different veins can help in the diagnosis of laboratory diagnosis of septic shock. And the many other testing of acute phase protein like CRP, or is also helpful. CBC low, usually sometimes high WBC count can be observed just due to the presence of the बैक्टीरिया इन आवर बॉडी. सो ये था सब कुछ सेप्टिक शॉक के बारे में था. सो विद रिस्पेक्ट टू यूएचएस पॉइंट, विद यूएचएस पॉइंट ऑफ व्यू, सेप्टिक शॉक और शॉक इज़ मच इम्पोर्टेंट. सो इसी के साथ साथ शॉक का जो है वो इस चैप्टर शॉक का एंड हो गया, और इसी इसी के साथ हीमोडायनामिक चैप्टर का भी एंड हो गया. सो you can ask questions anytime on WhatsApp. Please study from रॉबिन्स. ऑब्वियसली रॉबिन्स के अंदर बहुत सारी जो सेंटेंस हैं वो इस तरह से लिखे होंगे कि वो बहुत ज़्यादा जो हैं डिटेल में लिखे होंगे. सो आपको ये लेक्चर सुन के जब उनको पढ़ेंगे देन यू विल बी एबल टू अंडरस्टैंड दी understand from the book. So then good luck for your test and terms. Thank you so much.